Everyone, welcome to my channel Ravi Static Physio. So in this series of medical physiotherapist laws and ethics. So next topic is code of ethics for physiotherapist. So what is the code of ethics? Let's discuss about that. It involves systematization, defending and recommending concept of right and wrong behavior. So it works for the physiotherapists laws to have the constitutional right to work without any legal action, without any forcefully tension and like any kind of depression, anxiety of the central level. They have to be work professionally by us on self. So in the ancient Greek work, ethicos relating to one's characters, root word is to be ethos, character, moral nature. So the World Physiotherapy is 1951 establishment. The World Confidential for Physical Therapy, WCTP rebrands the World Physiotherapist 2022. More than 6 lakh physiotherapists worldwide, 128 members in the nation. So that is the codes and the have some conference on the nation on the member into the worldwide have to be established. More than 6 lakh physiotherapists have to be work in over the worldwide, and there is some has to be some institution and counseling to regulate by their authority into the different countries. So in our India, there is an Indian Association of Physiotherapists, which is IAP, which is a non-profit, non-governmental organization that represent the physiotherapy professional at national and international level. For any kind of physiotherapists who have like studying in this field, so if there is any kind of research, any kind of searching into their particular therapeutic approach, manipulation technique and electronic device, so in Indian Association of Physiotherapy have to be represent into the national and international level a particular person or the doctor or therapist. So registration under the Indian Society Act in the year 1955. So the registration of the Indian Association of Physiotherapy is a mandatory for the all physiotherapists who are working in studying into the India, has to be mandatory since 1955. A member of WCPT from 1967. So WCTP World Confidential Physical Therapy is establishment in 1967, but Indian Association of Physiotherapy is to be come into the 1955 into our India. So the what is the ethical principle of world physiotherapy? First is respect the right, personal dignity and privacy and autonomy of all individual. So the world physiotherapy say that all physiotherapy towards the patient, any kind of treatment, data, history, test, report, psychological treatment. So you have to keep confidential and maintain the privacy. Also, they have any kind of religions to maintain their dignity and don't show the gender biasness or the caste or religion biasness. Next is to be comply with the laws and regulation governing the practices of physiotherapy, governing the in the country in which they practice and the policies of their professional association and regulatory body. So you have to regulate the different law and regulation by complying the other countries. They have to be regulate and have their higher authority, which is World Confidential Physiotherapy. So they have to be some policies for the physiotherapy. They have to be implemented into the particular country. Accept the responsibilities for the exercise, sound professional judgment. So you have to be responsibility if you are a physical therapist or occupational therapist. So particular exercise you have to be sound as the professional judgment to show the international or national level of you represent your particular country as a doctor. Provide honest, competent or accountable professional service. You have to be such provide in a higher quality manner, in particular all of the patient, either it will be poor or either it will be rich. So you have to not show the gender biasness, rich and poor biasness. Provide fair, equitable, inclusive and quality service. You have to be A1 is quality service. You have to provide all of the person. Do not judge by the money. Charge the receipt at just fair level and recommendation for the services. You have to be charged according to your state, according to your village, according to your city and town. Do not too much charge over the patient. You have to be study over the country or out of the country. Provide accurate and appropriate information to the patient, client, to other agency, to community about physical therapy. If you are studying the patient to patient different, take one example, which is osteoarthritis. You are studying the 15 or 50 patient with a different reason. So you have to be share such information in a correct and higher and A1 quality level towards the higher authority about the therapeutic approach and rehabilitation goal and the treatment procedure, electronic gadget and rehabilitation and prognosis. Contribute to the planning and development for services which address the health needs to the community. Anything you have to come in your mind regarding the quality, regarding the planning development into particular country, implement of the law and regulation into the ethics into the physiotherapy. So you have shared such information towards the Indian Association of Physiotherapy, and it will be like beneficial. So you have to be represented by your own country into the international level or also into the world conference under physical therapy. So first is physiotherapists respect and right personal dignity, privacy, and autonomy of all individual. So that is the quality of services. Information about the physiotherapy services either provide information, consent, and refuse the treatment unconfidentially. Patient have to be anytime they will refuse the treatment procedure, and therapists have to be shares alternative option and keep maintain private and confidential about their personal information. Comply with law and regulation. A physiotherapist will have full understanding of the law and regulation governing the practices of the physiotherapy. Accept responsibility for the exercise of sound professional judgment. Already we have discussed. Provide honest, competent, accountable professional services. Already we have discussed. Provide fair, equitable, inclusive, quality services. Obtain subject information. Keep the data of the best evidence equitable, implement into their practice. Charge the receive the just on the fair level and the recommendation of their services. We have to charge equal level if there have to be a poor or if the rich person according to your village and according to the state. So the Indian Association of Physiotherapy ethical rule and regulation. So what is the rule and regulation into the Indian Association of Physiotherapy implement in our India? First is honest. You have to be honest towards the patient and into the International Association of Physiotherapy. Second is to be administration, treatment, and interest of the patient. You have to be keep quality wide treatment procedure on the patient at the administration treatment. Respect the dignity and basic right. You have to be not judged by the patient on their religion and their casteism, and maintain their dignity if there is any kind of wearing their own ornament and any costume. Refers scarcity prior consent. You have to be not by yourself, not treatment, not curable. So you have to refer such a higher level of physiotherapist or any kind of other doctor so they can will treat. Accurate information, comply with the law. So you have to share such information about the patient into the prevention of medical legal cases towards the Indian Association of Physiotherapy to prevention of any kind of harmful act towards you. Not to split fee. You have to be not biased or split fee into the rich person or poor person of their personality. Long-term well-being. You have to be rehabilitation protocol towards the patient of the long term, not into the short term. No personal gain. You have to not think about that to gain too much money towards the patient if you have a personal issue about that. No indulge or associate with the activity against the honor of physiotherapy profession. You have to not breaking or breach the rule of Indian Association of Physiotherapy to provide any treatment protocol which is not used in our India. Contribute to planning and professionals. So you have to be such contribute to the planning in the Indian Association of Physiotherapy as a collaboration to share such information about patient treatment, rehabilitation protocol, and prognosis and case study towards the thesis and also the research by representing your state or your national level at the international level. And updated. You have to be updated by yourself by recent research, recent protocol, manipulation technique, electronic device, and what is banned in our country. So that is the Indian Association of Physiotherapy regulation. Thank you.